Well, welcome to Skills to Pay the Bills in today's segment of JustAskFreeman.com. I'm your host, Freeman Owen Jr. Sitting next to me is my lovely wife and co-host, Carolyn Owen. On the last show, we carried the subject matter of caregiving. We had so much material. Carolyn, tell us what we're going to share with our viewers today.
Well, Freeman, as you were saying, we had so much material on our last show that we're going to continue that discussion about caregiving. And we're going to share with our viewers on how to be ready for aging parents and also how to prepare themselves to the various retirement vehicles that are available.
All right, Carolyn. I do want to talk about the various ways that we can be prepared for the later stages in life for ourselves and for our loved ones. So let's get started.
Okay. Now, Freeman, according to Pew Research, there are 76 million individuals who are ready to retire right now. Now, from 1946 to 2012, about 11 million boomers had passed away, leaving 65.2 million survivors and growing at 10,000 a day for the next 20 years. Now, Freeman, these numbers are astounding.
That they are.
So how are these alarming numbers affecting caregiving in 2018?
Well, let's look at life expectancy. You know, folks are living longer. Alrighty. If you are married, age 65, there's a 29% chance that you will live beyond age 95, at least one of us. When it comes to life expectancy, what we see today is that, let me rephrase that. You know, sometime, Carolyn, you've said, we have a lot of time in back of us. And I chimed in and I said, yeah, we do have a lot of time in back of us, but there's a lot of time in front of us. Yes. And one of the major concerns for so many retirees, age 65 today, is running out of money. They're concerned about making mistakes during their retirement run. And they look at aging parents and also what is happening with this sandwich, sort of like a sandwich situation. They have dependent adult children. So what we're seeing here in 2018 is there has been an escalation in the cost of skilled care. That's where long-term care, I refer to it as long-term care, is where you cannot perform two activities a day to live in, which we more or less take for granted.
Okay.
Alrighty.
Well, Freeman, also, some boomers are working beyond the age of 65 because they cannot afford to retire at the age of 65. So what happens to their parents who are in their 80s and above, who may have Alzheimer's or dementia or some related illness?
Well, what can happen too, I've seen a number of individuals age 65 and above have more or less depleted their retirement savings, and so they're working longer. And then with aging parents, they often don't have the resources because not only did they depleted their resources through maybe being co-signers for their children's education. You know, college loans are in the hundreds of thousands now. They may have made a purchase of a home, made mistakes taking monies from their retirement accounts, and therefore there was a heavy tax liability. Now you've got aging parents. Well, in some instances, Medicaid comes to the rescue, which is basically a long-term care program for individuals who are in low-income areas, or they have spend-down programs so that, of course, we don't participate in this, Medicaid retirement planning, where they spend down the assets, alrighty, and utilize Medicaid as their long-term care provider. Now, what I want to share with the audience too, Carolyn, as a former nurse and caregiver to your aging parents, you know firsthand about the Alzheimer's and related diseases on caregivers. Why don't you share your experience based on what I've seen? I said this in the last show. When it came to your parents, you had a dress rehearsal. You had your father and your mother, and you were so organized. it was amazing how you cared for the aging parents, but there was a team because you had 4 siblings and round-the-clock care. Why don't you share your experience and how that all fitted in with caregiving?
Exactly, Freeman, because with Alzheimer's, the symptoms of forgetfulness and so forth, and agitation or whatever can go on.
Right.
But I'm just going to give it a little backdrop. My father predeceased my mother. So my mother was the caretaker for him, so when he passed, my mother very wisely consulted a lawyer and made my brother the power of attorney as well as the medical and the legal rights. So that took care of that part. So she did end up with dementia, but we already had that part taken care of previously. And then my sisters all teamed up and were able to provide 24/7 care for my mom. My brother was able to get her to all of her clinic appointments, and then I was the away from home caregiver, so we would consult medically about things that were needed. So with all of us working together, it really did work.
It worked
beautifully.
out very, very well,
It did,
too.
yeah.
Now, viewers, this is a good example, and like I said at the outset of the show, there was cooperation. A few weeks ago, I should say, a retiree came in, and we were discussing caregiving. And one of the questions I asked, do you have aging parents? Excuse me. And she said, yes, and I have a number of siblings. And I said, are your siblings participating in the care of your aging parents? Well, she said, no, it's just me alone, because none of her siblings had seen the aging parents in 5 years. Now, let me give you a little analogy what happened to me with my aging parents. It was a team of one, just me.
I know.
All right. That was a lot of emotional, somewhat financial strain and physical strain. I guess I got about 4 hours a night in sleep. Family, that's what I have, children, and running a business. And I had assumed the role of being the, I guess, the power of attorney. I had to talk with attorneys to make sure there was an advance directive. So it is quite, it's a little different when you have a team, and I say this word, cooperation. And America's running out of family caregivers just when you need it the most.
Yes.
You understand?
Well, for generations, the nation has relied on family members to keep the aging loved ones in their homes.
Exactly.
But today, many Americans are growing older without the family support system.
Exactly.
Or
And the
family
future,
nearby.
it seems that for the future, most Americans who are approaching retirement, this gives you some indication of the changes and then the demographics, and is impacting, like I said, for generations. The caregiving crunch comes at a time when Americans reaching retirement age are in a squeeze unforeseen in generations.
That's right.
Now, what do you think about median incomes?
Well, the median incomes, including Social Security and retirement fund receipts, has not risen in years. The Americans have a high average debt, and some have incurred extra debt while caring for their own aging parents. So if they're counting on family members to care for them too, they may be very disappointed because the families may be too small or too far flung.
Exactly, Carolyn. And there's 34.2 million people that provide unpaid care to those of 50 or older. That's about 95% family. The cost is $500 billion annually. And that's been the backbone of the nation's long-term care system. That $500 billion worth of free care annually is 3 times Medicaid's professional long-term care spending, and what, of course, that's helping keeping people out of costly institutions.
But Freeman, the supply of caregivers is shrinking just when we need them the most. Every day, 10,000 people turn 65.
Exactly.
And in 2020, and there will be 56 million people 65 and older, up from 40 million in 2010. So.
Yeah, but meanwhile, we have the ratio of caregivers to care recipients. Now that peaked in 2010 and has been on a decline over the last 8 years, in large part because of changing family dynamics.
Well,
What
that's
do you,
true.
Well, what do you have to say about that?
Because families have fewer children. You know, you were an only trying to do all this.
Exactly.
And families in general have fewer children. Then you have the older adults, adults who have never married, or are divorced, or they have adult children who live far from their parents, so they're too far to care for their parents because they may be caring for one of their adult children.
Exactly. We said that at the outset. It's the squeeze or the sandwich. We have aging parents. We've got to take care of our finances, their finances, and if we have dependent adult children, we still have to consider the fact that we have to take care of their finances as well. Now we know that the private sector, that's not much of an option for many adults.
No.
The demand for private home health aides is expected to exceed supply by more than $3 million in the next decade.
You mean 3 million people?
I'm sorry, correction. Must be thinking about the cost of my mistake there. But many can't afford it, even if it's available. Your average health aid, the cost of having that health aid in your home is $49,000. The public support hasn't kept pace either. What do you think about Medicare and other government programs?
Well, you know, Medicare and other government programs only provide a fraction of the long-term supportive services that people need to stay in their own homes.
Exactly. And go ahead.
Yeah, and Medicare usually does, well, it does not pay for long-term care stays in nursing homes, which can cost up to $100,000 a year.
Yeah, just like in the metropolitan area, $137,000 per. Carolyn, the average stay in a nursing home facility is 2.9 years. Now you're talking $400,000 approximately, just for a 3-year stay. Now, after the person has spent down the resources like bank accounts and stocks, how does Medicaid fall into place?
Well, you know, Medicaid is a needs-based state and federal program.
Right.
And it will pay for most of the nursing home costs, but coverage and eligibility vary from state to state.
And you know, for the most part, families are now putting together patchwork support. First broken hip, that could be devastating. And what can happen, I'm gonna hold that note, all righty? Folks, we're gonna take a time for a station break. Carol and I will be returned after these important messages, so I want you to stay with us. And you're watching JustAskFreeman.com on Skills to Pay the Bills. Stay with us, we'll be right back. Well, thank you for joining us on Skills to Pay the Bills in today's segment of JustAskFreeman.com. Today, we shared some very important information on being prepared for your aging years as well as the aging years of your loved ones. You know, in that last segment, Carolyn, we talked about the private sector, as well as public support. Neither one has really kept that much pace in providing care, and then we discussed, of course, Medicare and other government programs, which only provides a fraction of the long-term care. And boomers, often caregivers themselves, are going to need care, and for many, it's really unclear who's going to provide it. But let me share this with you. I would recommend long-term care, skilled care. What it does, it preserves your assets and your dignity. You need a plan to pay for long-term care services. The plan that protects the assets you've accumulated over a lifetime from the ravages of long-term care expenditures and cost. I also would recommend a good solid annuity as well as life insurance, because now there's various companies that offer riders for critical care. Some long-term care companies might not provide the insurance for you because of pre-existing conditions.
I was wondering about that.
Yeah, so a lot of companies now that offer annuities, they offer life insurance, but they have riders there available to take care of critical care. Because you could spend down a significant amount of your resources if you're not careful. And that is why we always, I ask the new clients coming in, do we have aging parents? Do we have dependent kids? What we need to do is have predictable income. We got Social Security, hopefully that'll be around. Put aside funds to give you guaranteed income, all right? You need all the resources. And let me add this too. You cannot charge your retirement. You have to purchase your retirement. And if your parents are aging, set aside and you have to prioritize a long-term care program for them or some type of insurance that offer critical care, as well as for yourself. Because we mentioned the fact that 29% of married couples, there's an opportunity there to live beyond age 95. There's also non-traditional care. What do you think about that, Carolyn?
Well, you know, some older adults are considering things like taking in boarders, and the boarders can help with the shopping and repairs, or they can help with, or they rely on monitoring devices or delivery services.
Exactly. We got care from afar. You mentioned the fact that you participated, you were in Maryland, and your parents in North Carolina. Adult children are more mobile, has led to more long-distance caregivers. All right.
That's true. So children do what they can from hundreds of miles away, but checking references for an aide, managing the bills, or arranging grocery deliveries. But I know as well as myself, they often feel guilty not being there to take a parent to the doctor.
Exactly.
And uncertain about how someone else is really doing.
And technology, of course, plays a big role to alert remote caregivers to emergencies and keep families in touch. But what is amazing, it doesn't take place of someone to make sure there's food in that refrigerator. Technology is nice, it's wonderful. However, we got to, again, look at the geriatric care managers, often nurses and social workers. Managed care locally can cost anywhere between $50 and, $200 an hour. That is huge.
And while we're on that topic, technology can do a lot, but it cannot take care of that human touch.
Exactly.
That voice, someone checking on you to see how you're doing. So technology is very helpful.
Right.
But it's not the end all.
It doesn't end all. And let me pivot for 1 minute. I talked about long-term care. I think our viewers need to know that we have a brochure that's available for you, which covers the cost of long-term care. And also, it talks about how to protect your assets. You can email us at freeman@justaskfreeman.com. All right. Let's talk about the elderly to depend on volunteers.
Well, you know, there's a demand for increasing for agencies that provide help for the elderly. Because even when adult children stay in the area, they're often working 2 jobs, and they have children of their own, so they give what they can, but people can't get enough help when they need 24/7 care.
Exactly. Now, when you said 24/7, all right, you know, there are 700 programs, Carolyn, under the National Volunteer Caregiver Network. It serves 392,000 people at an annual budget of over $350,000 for the program in this network. And funding is an issue. Now, what about young kids?
Well, see, the concept is different. Now, funding children's initiatives is considered an investment in the future, so people don't have any problem with that. But older people are considered an expense.
And a burden. And folks, you don't want to be a burden on your children, your grandchildren, your loved ones, or anyone else. I'd recommend that you contact us. Email us at freeman@justaskfreeman.com, and I have a great brochure there which will cover the cost of skilled care, alrighty, and what you should, what you will learn about how to choose long-term care policies. Information that is right there for you, absolutely for no cost. Check this out, Carolyn. Ex-spouses. What happened between 1990 and 2010 when it came to ex-spouses?
Well, the divorce rate among adults age 50 and older doubled. So that means you have fewer spouses available as caregivers. So my understanding is that for some, ex-spouses are caring for their
Yeah, and what is happening too, we have what we call blended families, okay? Now you have, we see this all the time, second marriages, sometimes third and fourth marriages, but second marriages, they're bringing, one spouse is bringing aging parents, and the other spouse is bringing aging parents, alrighty? And again, there could be that element of dependent adult children, okay? So it's quite it's a puzzle to solve when I run into the blended family with aging parents, and the preparation that's involved in that to making sure that, as usual, the way we help our clients is avoid costly mistakes, all right, during the retirement run. Consider the factors of aging parents, dependent children, other types of ailments that could impact that individual or that family and loved ones. And then, you know, we have to come up with a game plan. All right, we have to consider. In the 21st century here, it's a whole different playing field when it comes to caregiving. And then you're aging yourself. Who's going to take care of you? So these are the kind of things, those kind of questions that that we address. And when you look at elder orphans, 1/3 of middle-aged adults are heading toward the retirement years as singles, especially women in particular, and are likely to stay or become single as they age. But about 14% of frail older adults, or 2 million, are without children. And that number is expected to double by 2040.
So, Freeman, you know, for this population, there are no natural caregivers.
Yep, and we need to construct a network around ourselves. Aging experts say, okay, that we have to put a game in place as we age. All right.
So here's some programs, Freeman, that can help. You know, transportation is a huge need for older adults who no longer drive.
Exactly.
But you have about 700 volunteer programs that provide transportation free.
Yeah.
And many help with things like grocery shopping and minor home repairs and yard work. And then there's the National Volunteer Caregiving Network, which compiles a list of these programs.
Yeah.
And places of worship, library, school, and community, or senior citizens also often programs often free.
For adults, that's true.
older adults.
You have the local agencies as well on aging can connect adults to services such as delivered meals. Okay, there's transportation and adult daycare services. You can go to eldercare.gov and the U.S. Administration on Aging, and then you could search by location the type of services that you need. Such as grocery shopping and changing bandages, home repair, adult daycare of food and nutrition. And Carolyn, I want you to help me with this. There's a dozen private companies that provide a range of help. What do they do? Focus in on.
Okay, now they provide companionship and medication reminders to dressing, bathing, and respite care for family caregivers. But it is not cheap if it's needed for full time.
Exactly. That's why I said that you have to purchase skill care in order to be an effective caregiver. And also, you need skill care that is, be effective caregiver to the aging parent. That's important. A lot of folks who have aging parents age 65 and above don't necessarily want their parents in a nursing home. And with long-term care, folks, the purchase of a long-term care policy can aid where the professionals will come to your home, a couple of days a week or whatever you need. And we talked about the fact that the cost is $134,000 in the state of Maryland, in the metropolitan area, over 6 figures.
In a nursing home, yes.
Exactly.
But then a homemaker costs $48,000 a year. Now that's a whole lot cheaper,
It
but
is.
that's a lot out of pocket.
Exactly.
And that's just based on 42 hours a week.
Right. Well, the technology, I mentioned that briefly last time, such as personal emergency response systems, remote monitoring systems, and mobile apps with medical reports, help families far away. Now, when your parents was going through dementia and Alzheimer's, and mine too, didn't have the technology to keep in touch. Well, Carolyn, looked like the clock on the wall is telling us that this segment is about to finish here. We're out of time. But before we leave, I want to remind our viewers to email us at freeman@justaskfreeman.com, and you can get a copy of our free toolkits covering long-term care, annuities, life insurance, retirement, and Social Security strategies. And I want to thank you for watching Skills to Pay the Bills in today's segment of JustAskFreeman.com. Carol and I will join you next week for another great segment. And I want everyone to have a fantastic week on purpose.